Sure thing. I'll just take off my mask.
Good afternoon, everyone, and welcome to today's COVID update with Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. Over the last 24 hours, we have identified 240 new cases of COVID-19 and completed about 5,500 tests. Our positivity rate is 4.3%. There are currently active alerts or outbreaks in 129 schools. 8 of these schools have had 10 or more cases infectious in the school in the last 14 days. There are currently 373 people being treated for COVID-19 in hospital, including 76 in the ICU. Sadly, 5 new deaths have been reported to Alberta Health over the last 24 hours. I extend my condolences to those who are grieving the loss of these Albertans and any others. Each death continues to be a sad reminder of the kind of impact this virus can have and why our collective efforts against it matter so much. The total Omicron case count for Alberta remains at 11. Given our current aggressive testing program, it is likely we will continue to detect more cases and respond to them as we have to date. I would also like to speak to some information I shared on social media on Monday, where some household members of these cases have tested positive for COVID but have not yet been confirmed as Omicron. I would like to confirm that both schools where there was a potential exposure have notified any possibly exposed groups. Anyone who has received a notification letter is asked to go for testing and monitor for symptoms. Alberta Health is also providing rapid tests to these schools. The schools will help distribute these to help parents and guardians monitor at home. I would like to remind families of school-aged children that there continue to be mitigation strategies in place in schools that are effective to help continue to prevent spread. This includes mandatory masking for students in grades 4 to 12 and staff in all schools and child care facilities, and recommended masking for kindergarten to grade 3. Cohorting and daily screening are also used. And as always, anyone with COVID-19 symptoms must isolate and should be tested through AHS. I know that some Albertans have asked why close contacts are not being legally required to quarantine at this time. Close contacts of suspected or confirmed Omicron cases who were not fully immunized are strongly recommended to quarantine at home for 14 days after their last exposure. All close contacts, whether or not they are fully immunized, should also monitor for symptoms, and if they become symptomatic, they must stay home and arrange for testing. From what we have seen from Albertans over the past 21 months, we know the vast majority will work with us to minimize spread in this way. This close contact management approach is more cautious than the approach we have been taking for the past several months. This is in order to minimize transmission risks while we learn more about the Omicron variant. However, due to the rate of vaccination in Alberta and the effectiveness of vaccines of preventing infection, lowering the risk of exposure from a close contact, and reducing general community transmission, we are not looking to reinstate legally mandated quarantine at this time. I would like to remind Albertans that the Omicron variant is a variant of COVID-19. It is not a new disease. While we are still learning about the Omicron variant's transmissibility and severity, this is not the first time a variant of concern has emerged in Alberta, and it will not be the last. We will not stop transmission. Our goal is to slow initial spread to give us more time to learn about the variant. We already have many tools at our disposal to limit the spread of COVID-19 and its variants and protect ourselves from becoming severely ill. That's why it's important to continue following the current public health measures in place, such as physical distancing, wearing a mask, proper hand hygiene, and staying home and getting tested if feeling sick. These measures have proven to be effective in helping to reduce the spread. It's also important for those who have not done so yet to be fully vaccinated. First and second doses continue to be available across the province. We are seeing a number of parents and guardians making the decision to get their young children immunized against COVID-19, and more than 60,000 children ages 5 to 11 have received their first dose of vaccine. If you are considering vaccine for your child, I encourage you to seek out reliable, accurate sources of information or speak directly with a medical professional who can answer your questions. I would also like to remind Albertans that a number of individuals are now eligible for booster shots, and I encourage anyone who is eligible to get their third dose. As of Monday, all those aged 60 or older are able to get a third dose if it has been 6 months or more since their second dose. For more information on eligibility or to book appointments, please visit alberta.ca/vaccine. I know that after nearly 2 years of this pandemic, a new variant is not welcome news. But I would like Albertans to keep in mind that based on all our previous experiences and the early information about this variant, I am confident that vaccines and our tried and true routines will continue to help us protect one another against COVID-19. Over the course of the past 21 months, our understanding of COVID-19 has grown significantly. We continue to learn about the virus from other jurisdictions and from what we see here at home. Every day, we closely monitor the spread of COVID-19 using a number of methods, and today I'd like to speak a little bit about how wastewater surveillance is being integrated into that work. Wastewater surveillance involves taking samples from treatment plants and then running lab tests to look for evidence of the virus. This approach allows us to monitor the prevalence of COVID-19 in a given area, functioning like an early warning system. It does not rely on individuals' decisions to get tested, so it complements our testing data. We have been working collaboratively for many months with the University of Calgary on a province-wide wastewater testing regime. Building off work also done by the University of Alberta, EPCOR, and Alberta Precision Labs, the University of Calgary is coordinating the collection and reporting of COVID wastewater testing in our province. This is happening in major centres as well as in a number of smaller communities. There are currently 15 sites across the province, including Edmonton, Calgary, Cold Lake, and Medicine Hat, and they're working to bring more sites online in the coming weeks. In general, the amount of virus detected in wastewater has been low and stable across the province since November. There has been an occasional spike in some communities, but the level of virus detected has always returned to baseline quite quickly, typically within 2 to 3 days. The University of Calgary will be launching a website later this week, so Albertans can see these regular data updates for themselves. As always, we will continue to monitor the evidence and emerging information from this and other research to share any important findings with Albertans. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We have one reporter here in the room, and we have questions on the phones as well. We'll start in the room. If you can state your name and outlet, and please proceed.
Sure. Hamdi Sawi, Post Media. I was wondering what the emergence of Omicron means for public health restrictions in the holidays coming up with Christmas, and especially for private gatherings.
It's a great question, and of course we really have only learned about Omicron in the last 10 days or so, so we are still watching to see what information is emerging from countries that have more cases. So far, the early indications, and I will stress early, are that it does appear to be spreading more quickly than Delta in those places where it has been first identified. So there is some transmission benefit it seems to have over the Delta variant. There is starting to be a slight uptick in hospitalizations, but early reports are that it does seem to be mild, especially in cases that have been vaccinated. We are still waiting to see more data, because of course these are early reports from relatively small numbers, so we can't draw conclusions. But we are watching both the emerging evidence on Omicron as well as our own data here in Alberta. We know the Delta variant continues to circulate and continues to cause not just infections but also severe outcomes. And so looking both at our own data as well as emerging evidence on Omicron will help us to inform any potential decisions about the holidays which have not yet been made.
Hammy, do you have a follow-up?
Yeah. So a recent study found that the Omicron variant's mutations may have, so one of them at least, may have come from the common cold virus. And I was wondering if that discovery had any bearing on the importance of other vaccinations like the flu shot for preventing further variants.
We, again, are still learning about the virus, and sometimes when we see the specific mutations, we can hypothesize about what that might mean in terms of the real-world impact, but we won't necessarily know for sure until we've had a chance to observe it a little longer. We know that in terms of the common cold, there are many different viruses that can cause the common cold. In the coronavirus family, again, there are some other types of coronaviruses that are part of that family that cause that kind of milder infection. It's quite different in terms of that common cold coronavirus is quite different from influenza. And so the influenza virus would, the influenza vaccine would not be expected to protect directly against COVID. However, we know we do have cases of seasonal influenza that have been detected, and the influenza vaccine is very important to protect against that. So I would say that in terms of the viruses that can cause syndrome of having a cough or a fever, that kind of respiratory illness, for most of those viruses, we don't have a vaccine. We do have one for influenza and for COVID, and of course COVID, whether the Omicron variant will behave significantly differently, we don't know. But so far, again, COVID has been much more severe than any of those other viruses, which again is why it would be recommended to get the influenza vaccine as well as the COVID vaccine to protect against those individual viruses. We wouldn't expect to see a cross-protective effect directly, as they are quite different genetically.
Great, thank you. We'll move to the phones now. Operator, can you put through the first caller, please?
Quinn Oler, Global News.
Thank you, Dr. Hinshaw. You've said there will be no changes for close contacts for Omicron cases, but also said that we don't have a clear picture of the impact of Omicron, including on vaccinated people. Some infectious disease experts we've talked to say we do need to play it safe to avoid community spread. Why are we not impact isolation changes as a precaution?
I want to be really clear that we have implemented changes for Omicron cases. So for Omicron, and this is true of either confirmed or suspect Omicron cases, we have reactivated universal contact tracing for suspect or confirmed Omicron cases. So we are treating them differently than non-Omicron or Delta cases. So when we do have a case that screens as a non-Delta or a case in a recently returned traveler from any country, then that particular COVID case is treated differently. All of their close contacts would be notified by Alberta Health Services. Those close contacts who are not fully immunized, whatever the setting, would be strongly recommended to stay home for 14 days after their last exposure. And both of those things are measures that we're putting in place that are over and above the measures that we've had in place for the last several months for Delta, where we have seen that, again, the majority of Albertans are working with us. They're doing the right thing. And so providing them with that information, adding formal contact tracing, adding that notification and that recommendation for that 14-day quarantine. Again, all of those are extra measures for Omicron cases. And again, in our experience, the vast majority of Albertans do want to work with us to protect their communities. And therefore, again, this approach is really emphasizing that collaborative and working with our neighbours and our friends in the province to be able to minimize the chance of the spread. We also have mandatory isolation that has never changed. So anyone who has symptoms of COVID-19, whether or not they are a close contact, is legally required to isolate. And those who test positive for COVID-19, again, are legally required to isolate for 10 days. So all of those are measures that are currently in place.
Quinn, do you have a follow-up?
Do we know the vaccination status of the Omicron cases?
Of the 11 cases that have been identified in Alberta to date, 7 of them were in fully vaccinated individuals, 2 were in partially vaccinated individuals, and 2 were in unvaccinated individuals. Again, it's important to remember that we have seen some breakthrough infections with all variants in the past. And so we do know that from the information that we're seeing, again, in places where they've had more Omicron cases, that there does seem to be a protective effect of vaccine against severe outcomes from this early information. And vaccine does remain a very important measure against Omicron, even if there is somewhat of an escape from infection, as we saw with Delta. We anticipate that the severe infection or the severe outcome prevention will remain a very important part of our community's protection against the Omicron variant.
Operator, please put through the next caller.
Francois Joly, Radio Canada.
Oh, hi. Thank you for taking my question. I was wondering, looking at the numbers across the country, we're seeing increases in cases in Quebec and Ontario, 2 provinces that have a higher vaccination rate than Alberta. And I was wondering if you had any theory as to why we don't seem to see the same trajectory, at least so far. Is it just that it's going to happen slightly later, or do you think there's something else going on here?
It's always challenging to be able to identify the exact reasons why cases shift in one particular place or another. We know that with seasonality, there is an increased risk of transmission as we get into colder weather, as people are spending more time indoors. And we know in those provinces, there's been a really steady state of restrictions for the most part. However, with increased seasonal pressures, you do see some of those increased transmission risks. And so again, if I had to guess, I certainly couldn't speak for my colleagues in those provinces, but we would expect in the fall and winter, with a steady state, that you would see some increased transmission risk. It's not clear how much the again, we have increased our protection against the virus with our increased vaccination rates, and we also have, in some instances, slightly stricter requirements in terms of our public health measures than we see in Ontario and Quebec, depending on the sector. So I think there's all sorts of different factors that go into it. There's weather, there's people's behavior, their willingness to follow the public health measures, and then, again, vaccination is just one part of that large equation.
Francois, do you have a follow-up?
Yes. Do we know how many people have booked for a 3rd shot so far since the last announcement? And could we see that schedule being accelerated if the uptake is not as fast as we saw for the 2nd dose, for instance?
I don't have the specific numbers for 3rd dose. We can get those to you offline. But absolutely what we're doing is watching very closely our supply as well as the demand. And then as we have sufficient supply, we should be able to allow or open up bookings to additional age groups based on the availability of the supply. We also know that for 3rd doses, it can take maybe a little bit of time from an announcement to when people actually book their shot. So again, part of my message today is to reinforce that all those who are eligible, everyone who's 60 and older, or anyone who is living in a continuing care facility, anyone who is a frontline healthcare worker whose 1st and 2nd doses were shorter than 8 weeks apart. All of those individuals, those who have immune compromising conditions, there is a whole list of people who are eligible for 3rd doses, and really would strongly recommend everyone who is 6 months or more from their 2nd dose and fits into one of those categories to take the advantage that a 3rd dose can offer, especially as we head into the winter season, the coldest months of the year, and where people are spending the most time indoors.
Operator, can you put through the next caller, please? Operator, please put through the next caller. I apologize for the technical difficulties, everyone. We're just reconnecting in with the operator.
Sorry for the delay. The next question is coming from Matt Woodman, CTV.
Hi there, Dr. Hinshaw. According to the latest data from Alberta Health, the city of St. Albert has the second highest case rate of any municipality in the province, with potentially more schools on the outbreak list than larger cities like Edmonton. I'm just wondering if you know what's driving transmission in that city. Thank you.
I haven't looked specifically at St. Albert lately, so I'm not sure. I, again, know that we have seen cases fluctuate in different parts of the province over time. And as I mentioned earlier to the provincial question, the same would be true of regions, that in terms of what's happening at that local level, if there's been events possibly where people were in close contact with each other. But I'm afraid I don't know specifically about St. Albert, and that would be a question we'd have to follow up with our local colleagues to see if they're aware of any particular recent transmission trends.
Matt, do you have a follow-up?
She already answered it. Thank you.
Okay, no worries. Operator, please put through the next caller.
Lauren Pullen, Global Calgary.
Hi, Dr. Henshaw. Thanks for taking my question this afternoon. Just to follow up to the Christmas gatherings question that was off the top there, I understand, obviously, with the Omicron situation and cases arriving and being detected in Alberta, the situation is very fluid. We're about 3 weeks away from Christmas, though. So when will Albertans have a clear answer on Christmas measures if they aren't available, as they aren't available right now?
I understand it's hard to wait, and that people who want to make plans for the holidays, whether they celebrate Christmas, whether those who are currently celebrating Hanukkah, you know, there's lots of different celebrations that are coming up, and we do recognize that it's challenging for people to make plans in this bit of uncertainty. I think that it is important to give ourselves time to be able to look at those early trends with Omicron, as well as looking closely at our own data. We know, for example, that, and I believe I mentioned this last week, that our ICU case count is sitting well above, not quite double, but certainly well above what we would see at the peak of a typical influenza season. So even though our numbers have come down from their peak when it comes to hospital and ICU capacity, we need to make sure that we're looking very closely at our system capacity, at the potential impacts if there were to be increased transmission from easing measures. And all of those things need to factor in as we look at the options. But again, decisions have not yet been made. And unfortunately, I'm not able to provide a timeline other than saying that certainly I'm well aware that people really want to have this information to be able to make plans. I guess at the current time, what I would say is that it's important for people, whatever kinds of plans they're contemplating making, to be thinking about all of the things that all of us have learned about COVID over the past 21 months in terms of the kinds of factors that will make a gathering as safe as possible, and that we'll be working to make sure Albertans have updates whenever those are available.
Lauren, do you have a follow-up?
I do, thank you. And just overall, we've been hearing some frustration from people just on the different rules and the impacts they're having. They can only have one other family household in their home right now, yet they can go to an Oilers game with thousands of other people or several other contacts at a restaurant. And I know we've seen that even though there are masking rules in place, they aren't always complied by when you're eating or you're drinking. What message do you have for those people who have been following all the rules, playing it safe, and are a little frustrated right now, given seeing those gatherings in very large numbers, yet not being able to have a couple people over in their home?
I understand. We've been hearing that frustration certainly since we implemented the measures, and that concern about being able to have gatherings with many people in those formal settings, whereas in a home setting having much tighter and stricter rules. One of the key differences is the ability to monitor and have a compliance framework in place with respect to making sure that vaccine status is being checked or a recent negative test. I recognize that masking continues to be a challenge, but I guess what I would say is that we know that indoor social gatherings, when we've looked at our data from all of our different waves, it's really clear that gathering together in someone's home in that informal environment is one of the types of activities that has the highest risk of transmission. And we know that our, again, our numbers in our healthcare system, while we've been seeing declines, and that's great, they have slowed. We're sitting at more of a bit of a plateau right now. And so any adjustments that we make to our rules, we need to be taking into account that whole system impact. So I would ask people to hopefully have confidence that we are looking at the options, that we know that restricting social gatherings does have an impact. It has an impact on people's ability to socialize, the sense of isolation, and that those have impacts on health too. So this doesn't go without consideration and attention. It's just that we also know that our acute care system has been under tremendous strain for a very long time, and we need to make sure that any changes that are made to our public health framework is taking into account the possibility of a combination of seasonal gatherings, the impact of seasonal transmission risks, the potential for some waning immunity, which is again why we're rolling out boosters, but that there could really be an impact from all of these things coming together over the next month. And we need to contemplate that as we try to weigh out all of the risks and benefits of changing the rules for gatherings.
We have time for one more question. Operator, can you put through the last caller, please?
Evan Nimick, CTV.
Hi, Dr. Hinshaw. Alberta Health still uses a more than a year-old guidance document that says aerosol virus transmission is the non-dominant form of COVID spread. In recent weeks, many organizations and leaders, including the Chief Public Health Officer of Canada, have acknowledged that the virus that causes COVID-19 can linger in the air like smoke, and aerosol virus transmission is the dominant form of spread. Why won't Alberta officially recognize the evidence and adopt new guidance?
It's interesting to note the evidence reviews that have gone on over the past year, and I would draw your attention to the National Collaborating Centre on Environmental Health, who released their latest update in October of this year, so just a little over a month ago. And I think one of the challenges when it comes to modes of transmission is that we have historically looked at droplet spread and airborne spread as sort of a categorical and in some ways mutually exclusive. Whereas I think what we're learning with COVID is that it is more of a spectrum. You'll note if you look at that National Collaborating Centre document that they use terminology that I find helpful, which is looking at short-range spread and long-range spread. And so short-range spread really being that the highest risk for transmission, when you look at all of the epidemiologic data, the highest risk is when people are in close proximity to one another, when they're spending especially longer periods of time in close proximity with each other, where there's no masking in use, and that short-range transmission is the dominant mode of spread. The long-range transmission, where you may have a transmission across a room or over a long space, can happen in accordance with the document that we released last year, is very consistent with the National Collaborating Centre for Environmental Health document that speaks about some of those risk factors. So when you have a closed space that's poorly ventilated, that's crowded, where people are spending long periods of time, especially engaged in activities where there could be higher generation of infectious particles, such as intense physical exercise, that it's really clear that you can have that long-range transmission. But when I look at the evidence, and especially documents produced by organizations such as the NCCEH, the document we produced last year, I think, is very well in line with that, to say there are many risk factors we need to avoid to minimize that risk of long-range transmission. But that short-range transmission remains. If we have our focus on measures that minimize that, we will have the greatest impact, as well as then looking at those other risk factors to minimize that long-range transmission.
Kevin, do you have a follow-up?
Yeah, I'm wondering, is it your belief that non-medical fabric masks are still useful against COVID rather than a more typical medical mask that you would see in a hospital-like setting?
Again, it's really clear that there's a gradient. So it is, I think, clear from the evidence that wearing a medical mask is more effective at minimizing transmission than a non-medical cloth mask. I think it's also clear that universal use of even non-medical masks does have an impact. So this isn't a binary in terms of, it's either or. I think that it's critical when people are using face masks that they have a good fit around the face, that there be multiple layers if it's a non-medical cloth mask, that there be multiple layers of fabric, including potentially a filter, that people are using them appropriately, handling them appropriately so as to not contaminate them. And so again, if there's somebody who has risk factors, and we've recently released an updated guidance document that emphasizes if someone's at higher risk for severe outcomes, then wearing a medical mask would be the most, or would be more effective at minimizing transmission risks than wearing a non-medical mask. However, again, across the whole spectrum, I think it's important that people do wear face coverings and that face covering be appropriate to their personal risk factors, and that it be worn properly. And again, that if a non-medical mask is worn, that it be worn in the appropriate way and that it have all of those characteristics that are outlined in both our guidance as well as the national guidance from the Public Health Agency of Canada.
That concludes today's COVID update. Have a good afternoon, everyone.